Hello, in this video, I will be talking about whether or not you will be able to work during breast cancer treatment. This is a tricky subject. Before I go on, I'd love to have you subscribe to our channel. We're always putting out new content. So whether or not somebody can work during breast cancer depends on a few things. Number one, the workplace. Do you like your job? Is your job important to you? Is it part of your identity and your meaning? Or do you hate your job? Is it something that brings you down, de-energizes you? Do you have a fraught relationship with the people you work with? The next thing is the type of treatment that you will be getting. So different treatments have a different effect on the body. And then the third thing is whether or not you can afford to not work during treatment. So your relationship with your job, the type of treatment you'll be getting, and then of course some economic concerns. Then I'll cover some things that might help you get through this. You may want to check out our video on talking about your breast cancer diagnosis with people at work and a couple other work-related videos that we'll link here as well. So your relationship with your work. Now, if you have a lot of autonomy and flexibility at work, it is much more likely that you'll be able to continue to work during your breast cancer treatment. If you work, on the other hand, a job where you have to be there 4 days a week, 12 hours a day, it's going to be really hard to maintain your work hours during treatment. If there's little flexibility for you to take time off, if you're not feeling well, or if it happens to be a day of your treatment, that type of role is going to be really hard to maintain. And if you have the ability to take sick time, that's something that you may want to talk about with your workplace. Is that possible for you to do? Can you take a short-term disability leave or a longer-term disability leave? This is where you might want to talk with the people in HR or a trusted colleague who's maybe been through something similar. The Family Medical Leave Act in the United States is applicable to companies of a certain size, and all it takes is for your medical team to fill out a form documenting that you need to get care. Now, in general, that's not paid time, but your job will be there when you come back. In terms of your work having meaning, I've had people who it was so important to them, their work was such an important part, they were on a conference call, an international conference call, while they were in the infusion center. So the answer to this question is as varied as there are people in this world. The next thing I wanted to talk about is the type of treatment that you're getting. What we generally recommend is that people take at least a week off following a lumpectomy or mastectomy without reconstruction. With reconstruction, especially when your own tissue is used, you are going to need a longer time to recuperate. The hope, of course, is that that recuperation time is not incompatible with your work and that you can take that time so that you can leave the operating room or your whole treatment experience with a breast mound, something that resembles your original breast or breasts. But the recovery time can be several weeks. We've had comments about this before, and if you've been through this, drop a comment. How long did it take for you to be able to recover? You know, if you have surgery on the abdomen, if that's where the tissue comes from, you can't drive for a few weeks because that area is healing and the pain will make it hard for you to be a safe driver. So these are all things to take into consideration. Chemotherapy, some people can work during chemotherapy, but not the day or two of chemo and the day after. So some people will get their treatment on a Thursday or Friday, take Friday, Saturday, and Sunday off work, and then resume work on Monday. Though flexibility is really helpful in being able to leave if you're not feeling well, or to have a shorter day can be really helpful as well. Now, some people, their work is so important to them, they are going to make this work. They get treated on a Friday afternoon and they're back at work on Monday. This again depends on your relationship with work as well as how you feel after your treatment. And with the first cycle of treatment, we generally recommend that you have as much flexibility as possible with chemotherapy because you just don't know what to expect. You know, the mind is a powerful thing, but so is chemotherapy, and you'll want to be really kind to yourself. In terms of radiation therapy, a lot of people do work during radiation therapy. Radiation therapy can cause fatigue. And if you find that your work is fatiguing and radiation therapy is fatiguing, they may not be incompatible. They may not be compatible. On the other hand, some people find that not doing anything all day while they feel they should be at work means that the benefits of not working are outweighed by the downsides of not working. Radiation therapy itself, after the initial treatment planning, is very short, and a lot of radiation places will work around your schedule, whether it's treating you before you go to work, at your lunch break if you're fortunate enough to live and work close, or at the end of the day. So radiation therapy, there can be a lot of flexibility. It may be a preference for you whether or not you work during radiation therapy. During targeted therapy and endocrine therapy, if you've completed chemotherapy and you're on targeted therapy and you're starting to get over the side effects of chemotherapy, a lot of people will resume work. I do recommend if you go back to work, go back on a Wednesday, or if you work the weekends, make it a mid-week return so that you have a shorter week as you go back the very first time. So will you be able to work during chemotherapy? It depends. As with all good answers, it depends. It depends on a lot of things. Work with your medical team. Ask them what to expect. You might want to add on an extra week after surgery, an extra week after chemotherapy. You may want to work on symptom management before you return to work. For example, if you're having sleep problems, you may want to make sure that you're able to sleep before you go back. That's especially the case if you need to be alert, if you're using heavy equipment, or if your job has intensive cognitive demands. You'll want to make sure that your symptom management is the best it can be before you go back. And then, of course, the third consideration is economic considerations. Not everybody has paid leave or flexible work time. If you economically have to work to be able to pay the bills and put food on the table, it's really important that you talk with your medical team. There may be things they can do to work around your work schedule. And believe it or not, some changes can be made to some systemic therapies so that you spend less time away from work. So talk with them about alternatives to combination chemotherapy and see if they might be able to offer you one chemotherapy agent at a time. In general, if they say you need to get them together, you really want to do that. But just let them know the concerns that you have. It's also worth talking with your social worker about grants that can be made for people undergoing treatment for breast and other cancers to help you, tide you over if you absolutely can't work. You don't have to do this alone. You know, a lot of people feel shame that they are living paycheck to paycheck, but most people do. And if you're watching in other parts of the world, you know, that we are very fortunate in the United States and in other parts of the world to have things like paid time off, some of us. But if you don't, there is hope for you and help for you. You just need to ask. There's no shame in this. Really, your health is the most important thing. So if you can find ways to get that support, that can be really helpful. And again, you shouldn't be afraid to ask. I've covered a lot. I hope it's been helpful. Drop a comment or a question below. We love hearing about your stories. And when you write your story, you share that with other people who are also watching these videos. So it's really an act of generosity. So we thank you for that. And as always, thank you for watching.